Hello, I am Andres Gandy, and today Team 5 will be presenting CVS Health Analysis. Our outline is as follows. I will cover the company. The strategies will be covered by Kevin Tran. The issues will be presented by Michael Roper, and the solutions by Alex Hoban. And then I will come back with a final conclusion. Now for the company. So we were tasked to select a Forbes 500 company and look into their issues and find strategies to solve those issues. Our team chose CVS Health. As you can see, CVS is number 7 on the Forbes 500 list. CVS seemed to be a great company to choose because they are in the business news a lot with all the new things that's going on with pharmacy and healthcare. And with so much going on in healthcare, we felt it would be a great company to analyze. So let's start from the beginning. CVS was founded in 1963 by brothers Stanley and Sidney Goldstein and a partner, Ralph Hoagland. If you look closely, you will note their very first logo in the picture on the slide. In 1969, CVS sold to Melville Corporation, which was a retail holding corporation that actually was a shoe company that went under a huge reorganization in 1996. In the 70s, CVS hit its first $1 million mark. In 1978, CVS found its competitive advantage by opening small health and beauty aid stores in shopping malls. In the 80s, CVS hit its $1 billion mark in sales. They began to provide benefit pharmacy management services, which is prescription coverage services. They also launched a mail order pharmacy and an IVIG home care. These are just a few things that gave them a competitive advantage. In 1994, CVS launched PharmaCare as their pharmacy benefits management program. And it provided a huge range of services to employees and insurers. In 1997, they worked diligently to acquire mergers and acquisition strategies. They started with buying 2,500 stores from Revco Company. And then in 1998, they acquired an additional 200 stores from Arbor Drugs Company. So in 1999, you can tell they really focused on industry structure and environmental opportunities by using the network industry structure and became the first fully integrated online pharmacy in the United States. In 2000, they started the Minute Clinics. The Minute Clinics was a great idea. This provided healthcare services that was provided right there in the community where you did not have to go to a hospital, you did not have to go to an ER, where you can get quick care right there in the community, right in the pharmacy. In 2004, they completed another acquisition that gained another 1,200 additional stores from Eckerd Pharmacy. In 2006, the Minute Clinic was the first retail clinic accredited by the Joint Commission. And this is a huge deal because most clinics do not go for the Joint Commission accreditation. So in 2012, that's where they finally exceeded over $100 billion in revenue. And in 2014, they just continued to buy more things. They purchased an infusion company and changed their name to CVS Health, which is what their name is known as today. In 2015, they had another huge acquisition with Omnicare. And in 2017, they stepped forward in the opioid crisis by providing naloxone, which is an opioid overdose reversal agent. And they provide the agent over 40 states. And this is a huge community service and health service to those who know of people who have this addiction is a huge epidemic, and this pharmacy is providing these services, making sure these medications are available where other pharmacies are not. So, yes, today, CVS Health, they see themselves as we are a pharmacy innovation company, a strategy of reinventing pharmacy, a purpose of helping people on their path to better health, and their values are focused on innovation, collaboration, caring, integrity, and accountability. So CVS Health at the high level, they have over 9,000 stores, 158,000 employees, and their revenue as today is 177.5 billion. And you can see the chart that's presented by Forbes 500 company on this slide. CVS Health Services gets a gold star with product differentiation. To start, the first service that they provide, which the service that they're most known for, is their retail pharmacy. It's easy access, is in a lot of communities, and they provide millions with prescription services. The pharmacy benefits management is prescription coverage. And they're using a lot of big companies are using this program to cover their employees for prescription coverages. And when it comes to clinical services, they do an outstanding job, and they have found a way to sustain their clinical services where a lot of retail pharmacies, for example, Walgreens, were not able to keep with that same adamant role. The Minute Clinic, it provides various different services that makes it easier for the patient to connect to healthcare. And these services, like I said, again, it's in a lot of communities. And this is one way that they provide a service that a lot of other retail pharmacies have not been able to provide. And when it comes to specialty pharmacy, they really have the advantage because they were one of the first to the market when it comes to specialty pharmacy. And specialty pharmacy is a huge thing in the news now. A lot of different companies are trying to get into the specialty pharmacy business because there's so much coverage you can get with government coverage for patients with this program. So there's a lot of money and a lot of revenue in specialty pharmacy because most of these disease states that cover drugs and specialty pharmacy are very expensive medications. So the return on investment is really good when it comes to specialty pharmacy. Also, the digital services. They have a CVS mobile app, they have a CVS Pay, so they're staying on board and staying new and staying current when it comes to digital services. So with all these different services that CVS Health provides, they're doing a great job with product differentiation. So now let's get to the executives. One thing that was clear to me was that this executive board differed from a lot of other executive boards. They have a vast difference in their background, and coming together with their different diverse backgrounds caused them to, I feel, to succeed. So, for example, Larry Merlo, and it's pretty typical that the CEO is a pharmacist, and yes, he is a pharmacist. But for example, Helena B. Folks, her previous work history is for Tiffany and Company, which is a jewelry company. And also, Stephen Gold, he supported IT brands such as Toys R Us and Polo. So you see, there's a very diverse executive group. And these are all their members.
My name is Kelvin Tran, and I will cover the strategy portion of this project. So let's go ahead and dive straight in to see what strategy CVS have been using in the past and how it was effective. CVS truly lives up to their branding through offering the best care and other services for their customers. They have proven to be a worthy retailer, and they will strive to provide the best through enhancing the technology in order to make life easier and more convenient for the customers. They are a success in advancing their mobile apps in 2012 along with a digital toolkit that was created in 2015. Over the past few years, CVS had revolutionized how customers manage their drugstore needs. In 2012, CVS joined the mobile commerce industry by creating their first mobile app to help customers better manage their health. Shoppers using the site can view prescriptions available for refill or pick up and access the health information center. Mobile shoppers can also sign up for Extra Care Advantage for diabetes opt-in program through the mobile site to receive exclusive savings on diabetes care products as well as healthy living tips and receipts. Extra Care Reward program has over 69 million active cardholders, which make it one of the largest retail reward program out there. Also, between 2012 and 2013, traffic on CVS mobile site and app increased by 250%. As consumers continue to embrace the smartphone revolution, CVS began to implement new technology to their app. This new feature helps simplify prescription refills and it also reminds the user to take prescribed medication. The update interface also includes quick dump links to popular features such as prescription refill scanner, CVS pharmacy store and minute clinic locators, mobile weekly circular with local deals and promotions, access to Extra Care account, and full commerce shopping. CVS' goal for expanding their toolkit in 2016 is to enhance the accuracy and reliability of the technology to ensure the user are provided with the greatest ease and enable them to manage their health at the same time. When the company expanded their toolkit, over 10% of CVS members improved their medication adherence after enrolling in the digital service, and they save up to $2.3 million in medical costs annually. Roughly about 5.1 million people sign up for the email and SMS alerts. The company has an increase of 40% growth on digital adoption. CVS aimed to increase adherence 5 to 15% in 2017.
Hello, my name is Michael Roper, and I will be discussing the most pressing issues facing CVS Health. While there are many issues that face any company the size of CVS, Group 5 will focus on 3 specific areas that we believe have had the most impact on CVS over the past few years, up until and including the current period. There is a heavy presence of Porter's 5 forces model in relation to CVS's current issues that includes, but is not limited to, industry rivalry, the bargaining power of buyers, and the threat of new entrants. The first issue Group 5 will discuss is the fact that CVS decided to rebrand itself and how we think that the rebranding strategy is not working. CVS decided to rebrand itself in 2014, going from CVS Caremark to CVS Health. The goal, per CVS executives, was to realign the company's name with its expanding role in providing healthcare services. CVS sought out to deliver certain healthcare services as well as products that would enable people to manage their health in a more affordable and effective way. This journey into personal healthcare, so to speak, also included the discontinuation of the sale of tobacco products in each of CVS's 7,600 retail locations. At the time of this decision, tobacco sales only made up approximately 4% of total sales, but CVS executives felt that this move was imperative to their new rebranding experiment. While CVS Health had some success with this strategy, including earning high praise for ceasing tobacco sales, as well as garnering significant traffic in their walk-in clinics, as well as their mobile app, they simply have not been able to make their rebrand profitable. The biggest challenges to the rebranding strategy have been a decrease in consumer goods sold, the inability to make up for the lost revenue associated with the discontinuation of tobacco sales, and competition. While the latest earnings for CVS Health in quarter 3 of 2017 have shown improvements with the looming Aetna deal, much of 2016 and 2017's earnings have been lackluster to say the least. As of Q1, or quarter 1 2017, CVS Health has reported a nearly 5% drop in the sale of general merchandise. These items include household products and beauty products, like toothbrushes and makeup, while overall profits have dropped some 8.6% during the same time frame. As previously mentioned, a large portion of these losses can be attributed to the inability to make up for lost tobacco sales. A recent Fortune article cites that CVS might have lost up to $2 billion since 2014 and lost tobacco and tobacco-related sales. Furthermore, improved beauty areas and pharmacy additions have drawn customers to rivals like Walgreens and Target, thus making it harder for CVS to compete for their core customers. Issue number 2 that Group 5 will discuss is the fact that CVS is not bringing in customers. So what happens when a rebranding effort has limited positive effects and your competitors begin besting you at your own game? You lose customers. And lost customers equals lost revenue. One of CVS Health's most pressing issues over the past few years has been the inability to draw customers into their retail locations. While the bargaining power of the customer, as well as strong competitive rivalry, comes into play for CVS here, the issue is complex. The second issue that CVS Health is facing is multidimensional and very much related to issue 1. As previously discussed, CVS's first issue pertains somewhat to lost revenue, and generally speaking, CVS's overall sales lagged for the better part of 2016 and 2017. Part of this trend of slacking sales was not necessarily CVS's fault, though. In order for insurance companies to make money in 2015 through 2016, many decided to restrict the pharmacy choices of their network subscribers. This cut costs as it narrowed down preferred pharmacies at which prescriptions could be filled. CVS analysts predicted that they could lose out on some 40 million prescriptions per year and thus millions of visits to their stores. Meanwhile, rivals like Walgreens were busy at work making deals with these insurance companies, like that of Blue Cross Blue Shield, that would make them the preferred low-cost pharmacy. Walgreens was able to sweep the rug right out from under CVS and has led to a cascade effect still felt by CVS to this day. In order to offset lagging sales, lower foot traffic, and competition, CVS got busy trying to make some deals of their own. In hopes of offsetting the acquisition of Rite Aid by Walgreens, CVS announced in late 2015 that it would spend some $1.9 billion to buy out Target's 1,600 pharmacy locations. The theory behind the move was that it would expand CVS's reach as well as increase their share of prescription fills. This has helped increase CVS's reach and exposure, but the jury is still out on long-term benefits. Furthermore, in an attempt to increase their customer base, last week CVS reached a $69 billion agreement to buy insurance provider Aetna. This combination of the nation's largest drugstore chain with one of its largest health insurers allows CVS to more easily use almost 10,000 store locations to provide primary care and basic procedures. Group 5 will now discuss the third most pressing issue facing CVS Health: the threat of Amazon's entry into the prescription marketplace. Even though the likes of CVS Health and Walgreens have repeatedly tried to squash the idea that Amazon will join the $300 billion prescription drug industry, the idea will simply not die down. Rumors have been flying around the internet for over a year pertaining to this notion, with some expert analysts seeing Amazon either buying or partnering with a pharmacy benefit management company, which would help drive up volume and create a mess for current business models like those of CVS Health and Walgreens. As late as August of 2017, the CEO of CVS Health, Larry Merlo, didn't see Amazon entering the pharmacy business due to various barriers to entry into the highly regulated marketplace. Merlo went on to describe how the trend in healthcare is geared more towards a value-based model and a focus on population health that requires the pharmacy to have a relationship with doctors, hospitals, and other community providers that have existed for years. Part of this value-based care involves how the consumer feels connected, as well as their clinical outcomes. Merlo felt it would be hard for an online sales arena to make these types of personal connections or produce the proper outcomes. In order to ward off new competition and to bolster their own sales, CVS Health and pharmacy companies like them have been busy with mergers and acquisitions. While combining the pharmacy business with a large insurer, as previously mentioned, would help increase profits, the hope too is that these new partnerships will make it even harder for a company like Amazon.com to come in and compete at a level where they would make a dent. Despite this pushback from retail pharmacy giants like CVS and Walgreens, Amazon continues to get closer to jumping into the business. Over the past year, Amazon has gotten the go-ahead from pharmaceutical boards in 12 different states in the United States to become a drug distributor, which could allow them to sell drugs directly to hospitals or physicians via their services like Amazon Prime. As recent as last week, it was also confirmed that Amazon personnel have had high-level talks with pharmaceutical companies Mylan and Novartis, both of which deal with large quantities of generic drugs. While Amazon has been mum on any official details of their plans, speculation continues to grow, leaving industry execs a bit worried. It will be interesting to see if Amazon pursues a prescription drug business, as it could soon impact the way millions of people get their prescription drugs.
Hi, I'm Alex Hoban, and for Group 5, I will be discussing the solutions for CVS and the issues that Michael just described. We've broken them down into essentially 3 different solutions to these issues, and we will especially be focusing on the recent acquisition of Aetna by CVS. The first solution we have to these issues is to keep pushing the CVS Digital Toolkit. This toolkit really adds to the customer's experience. It can increase the number of good outcomes by helping people stay on their medications and potentially lower patient costs by again helping people not miss out on taking their pills. A lot of studies have shown that one of the big drivers of cost for medications can be patients forgetting to take their pills or not completing a medication regimen. When this happens, the condition they were taking this medication for may not have been completely fixed as the medication was trying to fix it. What often happens is that the issue just kind of gets masked a little bit and they can potentially come back later, if not worse, than if the patient would have just continued taking the pills. This digital toolkit, which can easily be installed on a phone or a tablet device, has an easy way of reminding patients to, hey, you need to take your medication now, your blood pressure medication, your antibiotic, etc., and really allows for more interactive customer experience that can really help these patients. Another benefit of keeping patients on their medications and reminding them when to take them is that they don't have to go on future medications in the future, potentially. But by not having to do this and buy these extra pills later for the pills that you forgot to take now, that also can lower the patient costs, which is a big driver right now. And everybody is definitely sure about how much more expensive, especially in the US, pharmaceuticals are compared to the rest of the world. So this digital toolkit has the ability to potentially help patients lower their medication costs, which would be a big driver for people to try to go, hey, this toolkit's helped me save money. I can save money. I need to go to CVS to get my prescriptions. While I'm there, I pick up some other stuff, and then CVS can bring in a bigger customer base and increase their sales. The next solution I will discuss is the finalization of the acquisition of Aetna. At the time that this slide was made and the header was put in here, the acquisition hadn't been finalized. As of right now, it is, pending review from the federal government. However, back to the case of how this helps CVS, what this allows CVS to do is focus much more on the customer experience, where many of their rivals cannot. It gives CVS the opportunity to negotiate with pharmaceutical companies to potentially have lower prices than many of their competitors. It also allows CVS to become maybe a clinic of sorts for local communities, so they can leverage the insurance option to refine in-store options and become more than just a store. They can also become a clinic as well and offer some semi-outpatient procedures or just clinic setting type things that can keep patients from having to go to an emergency room, again lowering costs. This also along the same lines of this, as Michael mentioned, a lot of Walgreens went in and really became the preferred supplier for many of the prescriptions from a lot of the insurance companies. Now that this deal is finalized, what CVS needs to do in turn is to turn around with all the other insurance companies and make sure they can get some footing back on this preferred supplier of pharmaceuticals. Because if I'm going to go into a pharmacy and it's not going to carry my prescription or my insurance isn't going to cover it, I'm going to go somewhere else. So CVS really needs to be able to serve every customer that comes in. So if somebody comes in to get a prescription filled, CVS needs to be a place that can fill it. So if they can't fill it, they're just going to lose out on customers as they already have. That ship needs to be righted right now. And our final solution I'm going to discuss has to do with Amazon and the threat of entry into the pharmaceutical marketplace by Amazon, or the pharmacy marketplace by Amazon. What CVS needs to not do is not try to compete directly with Amazon. They don't have the infrastructure in place to really compete with Amazon's online business. Not even Walmart really has a good infrastructure to deal with this and to really compete on the level and do what Amazon is currently doing. What CVS needs to not do is to not try to replicate the Amazon model and keep doing what they're doing best. They've got just build a customer service reputation. You've got the digital toolkit. If you get the Aetna acquisition and then your in-store service, you can be known as the service provider. Hey, if I go into CVS, I know I'm going to get treated well. I know they're going to have solutions. I'm going to have a good experience. Versus Walgreens, where, okay, it's just another drugstore. This really gives CVS an opportunity to push much further beyond the boundaries of what they currently are right now. Also, with as big as CVS is in their negotiating power, there's no way Amazon should be able to offer cheaper prices or be able to sign better agreements with insurance companies or pharmaceutical companies to provide prescriptions for a lower price than CVS. CVS needs to make sure that they are at least competitive. That on some cases they can be a little more expensive, but in general they need to be one of the lower cost providers. Because if I'm a customer and I'm cost conscious and I know that, hey, my prescriptions are going to be cheaper at CVS than they are, say, at Walgreens or even Amazon, that's going to make me try to choose a CVS because of that can really save me some money. So CVS needs to strive to do that. They can potentially bring in the customers they may have lost to Walgreens through this whole situation. And again, much of CVS's model here is to a customer comes in, gets their prescriptions, buys some other things while they're there, and then leaves. So really the idea of CVS is to get somebody in the door with potentially low cost options or customer service in general. That's the general way to go. Along these same lines, with the purchase of Aetna, CVS does have the opportunity to, again, leverage this purchase to push customers into the store and potentially give them another option. And the way they do this is by just reimbursing more for prescriptions that Aetna customers buy at CVS. Walgreens cannot match this move because they don't own an insurance company. With CVS owning Aetna and having a subsidiary of itself that is an insurance company, they can build business efficiencies within this system such that a Aetna prescription and a customer that has Aetna insurance, if they fulfill their prescription at CVS, now Aetna will reimburse more for that prescription than they would potentially at a Walgreens, which again means the customer that's coming in, hey, I can get essentially a cheaper price at CVS, and this could potentially help drive people towards Aetna because they know, hey, I can leverage this. I got a CVS right around the corner. This is an easy idea. I just buy their insurance, go to their store, get better prices, as well as bringing people into the store to then buy more things. And finally, with all this together, and Amazon potentially coming into this marketplace, Amazon can't be a complete healthcare company the way that CVS potentially can with this purchase. CVS has the opportunity to become much more of a healthcare provider and a healthcare store and transform much more away from the idea of, well, I'm a pharmacy with some basic grocery supplies similar to a Walgreens, maybe a little higher scale, maybe not, depending on your opinion of it. but they really have the opportunity here in the near future to transform. And we highly recommend that they transform from just a brick and mortar store as they are right now to a much bigger healthcare company that's much more service oriented and ideally is targeting customers to bring them in because of the services they can provide and to be a kind of one-stop shop for all your potential medical needs. So as I mentioned previously, while we were making this presentation, the deal for CVS to buy Aetna was finalized for $69 billion. And because we saw this as such a big deal and was one of our main solutions that we were, hey, suggest we need to finalize this, I wanted to take some time to talk about this in a little bit bigger detail and see what this could potentially mean for CVS and some different ideas they could potentially implement to really transform their whole business into something that could be much bigger. So one thing CVS could do with this is to become just a one-stop shop for all your healthcare needs. Now that they own an insurance provider, they could even employ doctors on their sites to be, I guess, a community clinic where you can go and see your doctor for minor issues that you wouldn't require an emergency room visit. Or these doctors could screen patients, and then if they are in serious need of help, they can then send them to the emergency room from the CVS. But you can, with that screening effect, you don't need to incur all the bills that come in that are associated with going into an ER. If I've got a flu, they can go into the CVS and get told, hey, you've got the flu, go home, rest, instead of going into an ER where they could potentially infect more people. Even though there are people in the CVS store, there's typically more people in a worse situation in the ER, and you can easily use doctors as kind of a screening tool here to do that. At the same time, the patient can go in and maybe even see their primary care physician, who might be stationed inside this CVS. And if they can go and see their primary care physician, they can be written a prescription by that primary care physician, walk over to the counter, get their prescription fulfilled, and walk out the same day without having to be given a prescription from a doctor to then drive to another store to then have it filled and then leave. They can do it all in the same place. What this really can mean for a lot of different things is endless. There are a lot of possibilities and different avenues that CVS can go down with the way they've set this up. One big thing, especially for community-based CVSs that a lot of people end up walking to or in a very short driving distance, is that patients could have much easier management of their chronic diseases such as diabetes. So if I'm having insulin issues, I can go to my CVS that's maybe right around the corner to see a doctor or to consult with a pharmacist about what's happening. Hey, maybe I need some more insulin. It's much easier for me to get to this to get my insulin, etc. There's many diseases that can be that this could be applied to, and CVS really has an opportunity to really transform the corner pharmacy marketplace as we see it today and really affect a lot of different people and even potentially lower the cost of healthcare.
Finally, the conclusion. Based on our analysis, CVS is moving in the right direction. They're doing all the right things at all the right times. We believe in CVS Health and we're excited that we picked them as our company to follow. And we do conclude that they are moving in the right direction. And with the strategies that they have and the direction that they're going, CVS will be a great company for years to come.